I hope all of you had a chance to hear Chuck Denham yesterday and Dennis Quaid's presentation. They were eloquent speakers as advocates for patient safety. And in that regard, they share a central goal with all of us. You know, some years ago, Mr. Quaid was in a movie that became an American classic, The Right Stuff. That told the story of the first 7 astronauts in our early years of the space program. Dennis Quaid portrayed a fellow who grew up not far from where I live and work in Oklahoma, Gordon Cooper. So in the film, Gordo Cooper was something of a character, as I understand he was in real life. He constantly assures all those around him that things are going to work out just fine. And in one scene in the movie, he actually turned to his skeptical wife and said, "You know, it's a whole new ball game now." A whole new ball game. That could well serve as a theme for our annual meeting this year. It is indeed a whole new ball game in the profession of medicine and in the specialty of anesthesiology. 13 days ago, the landscape of American medicine changed in fundamental ways. And yet, on a day-to-day basis, our mission remains the same: the safety and medical care of our patients. I know you watched the repeated showdown in Washington as October 1st approached. The debate over health care reform and how to deliver it and how to pay for it in America is just beginning. ASA's role is to address those issues of greatest concern to our patients and our members. There are a number of issues that are critical to our patients. First among them, the bedrock principle of physician supervision of anesthesia care. Let me assure you today that ASA will remain unwavering in our determination to uphold that principle. Whether countering opt-out attempts or advocating that chronic pain and critical care medicine are the practice of medicine, we are determined to educate that the best outcomes arise from physician-led healthcare teams. Our perioperative surgical home initiative remains at the core of our patient safety philosophy. What better way to highlight our perioperative consulting role? What better way to highlight our subspecialty training and expertise, especially in critical care and acute pain and chronic pain medicine? Our recent initiatives involving our Anesthesia Quality Institute and our Health Policy Research Initiative are designed to help us take a critical look at what we do and ask, how can we improve? How can we do it better? The information from these 2 initiatives will help strategically position ASA to not only survive, but thrive in this era of healthcare reform. ASA is also dedicated to our members, and in that area, the whole new ballgame makes our advocacy responsibilities all the more critical. So just as we advocate for our patients, so too must we advocate on behalf of our specialty, because our destinies are linked. ASA has and will continue to lobby for major changes in the Affordable Care Act, especially regarding repeal of the Independent Payment Advisory Board and the Non-Discrimination Clause. We will continue to support truth and transparency legislation and rural pass-through legislation. We will continue to work towards solutions for our current and looming drug shortages. We will continue to support the repeal of the sustainable growth rate and speak out against further reductions in Medicare payment rates. The implementation of this far-reaching law will continue to do what it's already done. It will cause policymakers and the American people to look long and hard at how we deliver health care in 2013 and beyond. I believe this ongoing debate will be good for us in the long run, because it gives us an ideal podium as physician anesthesiologists from which to educate our patients, our members, and the public about who we are and what we have to offer. Very few other medical specialties come into contact with more patients than anesthesiology. We come into contact with them at an especially vulnerable time in their lives. We ask them to place their lives in our hands. In virtually every patient encounter, they place a high level of trust in our knowledge, experience, and expertise, and rightly so. Who better to help them sort through the controversies and dilemmas of healthcare? Who better to answer their questions and calm their fears? Who better to earn and retain and build on that trust? I'm excited about the initiatives already underway. Our When Seconds Count education endeavor is reaching out to patients, colleagues, and the public with a core message. Patient safety comes first, last, and in between. And it's our role as physician anesthesiologists to be vigilant about that fact. One of the goals as your president in the year ahead will be to continue to transform our communications with our patients, our members, and the public. I call it educating with every encounter. Each of us can be an ambassador for the specialty of anesthesiology and the profession of medicine. We have never had a more receptive audience or a better time to tell our story. Polls have shown that a substantial percentage of Americans have many questions regarding the future of healthcare with the dramatic changes now underway. They will turn to someone for the answers. Our goal is to make sure that it is to ASA they turn, and that when they do, we have the answers for them. While our leadership and our staff are well positioned to respond on many fronts, I want to remind you that we have a secret weapon. Each and every one of you and each and every anesthesiologist in America, for as much as we have to reach out and educate and engage our patients, so too do we have to reach out and educate and engage every member of the American Society of Anesthesiologists. Let me make this point crystal clear. We have never faced so many issues in the public policy arena as we will face in the next 12 months. But the flip side of the coin is we've never had so many opportunities to tell our story to those in positions making these crucial decisions. In addition to our advocacy, our members look to ASA for up-to-date education. Our journal, Anesthesiology, remains one of the most valued resources. Our standards and our guidelines and our statements related to our specialty are second to none. Our meetings, from this amazing annual meeting to meetings on practice management and legislation, and our new quality meeting, provide vital educational and professional development resources. ASA is committed to providing educational products to benefit our members. Events of the last 2 months have demonstrated that our structure and governance serves us well. As an organization, we are financially sound, but fiscal stewardship must continue. We anticipate a move into our new headquarters in Schaumburg in June of 2014. Our staff have never been better equipped to support our volunteer physician leaders in order to serve our members. As you can tell from the extensive program this week, CEO Paul Pomerantz and our highly professional staff are on the job and doing it well. I learned in the first 2 years as your first vice president and president-elect that our society is only as strong as our membership, and that is very strong indeed. We are driven from out there among you, not from the top down. That's the legacy that is handed from each president to the next, and one that I will continue to honor. The coming era of healthcare is bound to be one of transformation. If you've had the opportunity to read my President-elect annual report, you will know that I use that term over and over again. Transformation. Transformation is different from mere change. Transformation involves fundamental shifts. A caterpillar is transformed into a butterfly, or if it's unlucky, it gets eaten by a bird. So our goal must be to emerge from these transformative times ahead as butterflies, better equipped than ever before to serve our patients, to be vital leaders of the physician-led healthcare team, to sustain and expand our practices, our specialty, and the American Society of Anesthesiologists. 2 years ago, I stood before you as a candidate for first vice president. I reminded you of my own unique background: ICU nursing, nurse anesthesia, medical school, residency, academic practice. I count at least 4 personal transformations in that brief biography, but there have been many more. It's been a transformative experience to serve our society leadership. It's been an honor and a privilege to attend so many of your state component meetings. There is great wisdom at the grassroots of our bottom-up society. It's always transformative when we undertake the care of our fragile patients and see them through to successful outcomes. Like all of you, I have learned and grown from the many patient encounters over the years. This week marks one more personal transformation, but on a much grander scale, this month signifies the beginning of a new era in medicine in our country. We can and we must rise to that challenge. We owe it to ourselves, we owe it to our colleagues, we owe it to the ASA, and most of all, we owe it to our patients. Let me close with a word of thanks. You have blessed me with the high honor of leadership among peers I deeply honor and respect. My goal and my promise to you are the same, to lead ASA to the best of my abilities in the year to come. Just as our patients place their lives in our hands, you have entrusted the leadership of ASA to a leadership team that will work tirelessly on your behalf and on behalf of our members. Thank you for this opportunity to serve as your president.